A new CDC survey has confirmed what many feared. Mental health concerns among high school students in the U.S. were exacerbated during the COVID-19 pandemic. But as we work to get back to pre-pandemic routines, those issues don't just disappear. We explore the topic with a psychologist in today's Health Matters. We may be coming out on the other side of a global pandemic, but Dr. Leslie Taylor, a psychologist with UT Physicians, says many are now still dealing with or have developed mental health issues in a post-pandemic world.
Prior to the pandemic and the decade prior, we were seeing increased suicidal ideation among youth at alarming rates, and we've continued to see increased severity over the time of the pandemic, particularly in adolescent girls.
A recent CDC survey revealed more than a third of high school students in the U.S. experienced poor mental health, at least most of the time during the COVID-19 pandemic. 44% felt persistent sadness or hopelessness. 1 in 5 teens seriously considered suicide, and 1 in 10 students had attempted suicide. Dr. Taylor says it wasn't just fears over COVID, but the increased cases of abuse and domestic violence during pandemic restrictions that contributed to a rise in mental health issues.
We talk about how prevalent abuse can be, and that it doesn't have anything to do with you or anything that you did. And so that's a big piece of kind of untangling what happened and helping them make sense of the events.
Dr. Taylor says feelings of sadness and anxiety are fleeting, but a person should seek professional help if their eating or sleeping habits change. They no longer enjoy activities they used to like. They easily feel overwhelmed or anxious, have feelings of hopelessness, or they feel disproportionate rage, anger, or resentment. And parents can offer support in another way.
In Texas, one of our biggest concerns is that we know that people may have things at home that youth can harm themselves with. It could be a gun, it could be, a knife, anything like that, pills. And so if parents are aware that kiddos are struggling, then they can restrict the access. And that's a huge way to keep kids safe.
She encourages teens to seek help outside of friends and social media.
Again, that you are not your thoughts, and that if you're having those thoughts, it's a sign to reach out to somebody for help.
For more on our series with UT Physicians, go to khou.com/healthmatters.